Hi everyone, good evening. Good evening everyone, how are you all? Welcome to the class. Good evening everyone, I can see many of you are talking about the food. Interesting. Hi Akshay, hi Prakhar, hi Satyajit, Abhijitya, Anshita, Nibhya, Shikha, Varshini, Parvi, Ritika, Ritvik, Farhan, Payal, Shlok, Shruti, Papya, Jyotsana, Manimala, Ritushri. Hi everyone, good evening. Now I have to focus. Yes everyone, how are you all? I hope all of you are doing amazing and welcome to the class. Yes? Awesome. So today is a very interesting class, right? We'll be quickly revising the whole chapter of why do we fall ill, right? Yes, it's a very interesting chapter and today we'll be revising the whole chapter. Now let me just tell you in the beginning only because I can see many of you are asking about the Menti. So we don't have the Menti today, right? But we've thought, let's quickly recap the chapter because we have studied this chapter quite a while ago. And next time when we'll be meeting, we'll plan something, right? So today we will be discussing about this particular chapter. It's a very quick revision, right? I'm sure all of you are, super confident about this particular chapter. But let's quickly revise it in just, a little bit of time. And then we'll be, moving ahead. And next time when we are meeting, definitely we'll have something more interesting for you guys. Yes, everyone. So just give me a minute, okay? And of course, it's all in all, it's really very amazing. So don't worry about it. Yes, right? So good evening, everyone. I can see many of you are here with us. That's amazing. So let's quickly start the session, right? We'll be starting the session, and I want all of you to be focused over here. You can write your answers, write in the chat box. We'll be able to definitely discuss out if there are any questions. Yes, Satyajit, I can. Okay, on that note, everyone, let's start our class very quickly. So, very quickly, let's discuss about the why do we fall ill chapter. Now, if I ask you what is health, can anyone write in the chat box what is health? So, again, it's a very interactive session because this is a chapter we already did, right? So, I want you guys to answer the question that I'm asking in the chat box. Abhijitya will be discussing about the contributory causes that will be causing a disease. We'll be going ahead with that. Very good, Nibha. I can see the state of well-being. Health is a state of well-being. Health is a physical, social and mental well-being. Very good. A state of a complete physical, mental and social well-being. Definitely you have a clear idea what health is, right? So let's quickly start with it. When we talk about the health, right? Now, of course, health might vary to you and me, but of course, if you go by the definition of it, we will call a person healthy. Of course, if the person is physically well-being, like of course, if they're physically fit, if they're mentally fit, and of course, they have a social circle. So all of these three important aspects will be combining together, and of course, we will be calling a person healthy. So basically, health, when you talk about health, is a state of complete physical, mental and social well-being and not merely the absence of the disease. ऐसा नहीं है कि अगर we don't have any disease, अगर हमारी body में कोई disease नहीं है, that doesn't mean that we are not healthy, right? We can be healthy, हम healthy हो सकते हैं अगर हम physically fit हैं, if we are mentally fit and of course socially fit, right? Going out, meeting people, if you are working on our mind, training our mind, doing meditation, and of course, if you're physically fit, all of these are really important, right? So we are clear, right, what health is. So that's a very good and important definition we have. Now let me ask you, yes? Okay, let me ask you, what are the benefits of health? We know what health is, right? Right? We know what health is. Now you tell me what are the benefits of health. If you and me are healthy, what will happen? Very basic question, right? Yes, we will have that pilled animation. After this, Yeah, because of the COVID, right? Yeah, we're not interacting with people, but this is how we can interact. Still, we are able to express ourselves. See, we are meeting virtually, right? Yes, we are meeting virtually and still we are able to connect. So, yeah. Yes, you'll be able to enjoy your life. You can perform good in your task. You will be disease free. You can easily carry out your daily activities. There will be increase in the efficiency of the work. Very good. Yes, so that's it over here. We know what are the benefits of our health, of especially good health. And here for everyone, here we have the pilled animation, right? Let's go back and see it again. I'm sure you missed it because I was missing it too. So here we have the benefits of a good health. Of course, the first thing as a student, right, when we talk about, we can easily focus or can concentrate on the particular subject that we're learning at that particular time. We can definitely enjoy, we'll be happy from within, right? We'll be very positive, we'll be ready to learn more things, we'll be ready to face the challenges if at all there are any in any particular subject or in life, right? Then of course, we can do meditation. We can actually train our brain to do wonders. And of course, you'll be performing good in overall, be it the sports, learning, and so on. So here we have a very few of the benefits of the remain healthy. Yes, so are we clear with this? Papia, that's a secret, right? We have an amazing team who does all wonders. So we know what is health and we now understand that, we have the benefits of a good health. Now let's quickly move ahead to an important topic, that what are the factors that will be affecting your health and my health. Of course, we have first the personal hygiene, right? And then we have the public hygiene. This is really very easy for all of us because we have already studied it. So just focus over here. So we have the personal hygiene and the public hygiene. When we talk about the personal hygiene, it talks about a you or me, right? How we are keeping ourselves neat and clean. So when we talk about it, we have the bathing, right? We're taking bath every day, brushing our teeth, toilet hygiene. We are using a clean toilet, right? Washing our hands, and of course, good food. So all of these are the personal hygiene that you and I can definitely do, and we do it, right? Yes? Okay? So that's about the public hygiene. Yes, everyone, are you there with me? Yes, give me a thumbs up. I can see all of you laughing. That's good. Let's laugh together. Right, but I want all of you to focus in the class. Okay, very good. I can see a lot of thumbs up. That means that you're there. No, we don't have the Menti. Yes, we don't have the Menti quiz today. We'll be revising this whole chapter. Awesome. Love to see your response over there. Claps. So we are discussing about the personal hygiene. Of course, you and I do that. And over here we have the public hygiene. Of course, as a citizen, we should be aware about that what we should do when we are in the public. Because if you have a clean surrounding, if we do not litter, if we wear the mask, if we are following proper social distancing, and just these are the two things we are discussing in the 3-year scenario. And of course, if there's no basically we don't have a water held at a particular place, what are we doing? We are actually trying to keep our surrounding neat and clean so that we are not getting affected by any of the disease, right? And of course, we are keeping ourselves healthy. So these are some of the personal hygiene and the public hygiene practices that we should follow as a good citizen and of course as a good individual. Yes? Now, let's quickly talk about the disease, right? We are discussing that we'll be keeping ourselves safe, but from what? We are keeping ourselves safe from the disease. Now, what is a disease? Yes. Yes, everyone, can you write? Nibha, we did the natural resources chapter. Yes. We are revising. Why do we follow it? Because it will be there in your examination. Yes, very good. I can see the answers. Disease means the disturbed is, right? If you break this word into two parts, we have the word disturbed ease. That means definitely a state of being uncomfortable. If I have a cold, right? If I have a cold, I'll not be feeling so energetic, right? I'll be like, okay, fine. Yeah, we'll be learning this. I'll be using my handkerchief or maybe I'll be coughing in between. So I'll not be comfortable in what I'm doing, right? So disturbed ease, a state of being uncomfortable. So are we clear with this? Yes, we will be having the quiz, right? very soon. But in today's class, we'll be just having the revision. So I would request all of you to have some patience and let's wait for one more week and let's focus on today's class. Yes, that got shifted, right? Awesome. So now we know what is a disease, right? And let's quickly talk about the things that we'll be seeing. Now when we talk about the disease, right, we always think of the symptoms. Okay, I'll say, I have a headache. Of course, I can only feel the headache, right? You cannot feel the headache. So, symptoms are those that can be easily experienced by the patient and not by the any other person, right? This actually indicates that there may be a disease, but of course does not indicate what type of disease or which disease it is. Then of course we have the example like cough, headache, etc. So all of these you and I can experience, right? You and I can definitely experience it. So, stomach ache is happening, there's a headache, right? And of course, chills, fatigue, I don't have the energy to learn today. That fatigue, right? Of course, you and I can only experience if you have it or I have it. Then comes a sign, and of course, signs are the one that can be easily seen by the third person. In that case, we have the doctors, right? Now, doctors can easily measure it, right? They can actually touch our body. They can actually, work on the impulse. They can actually read it. They can actually measure the temperature. And of course, based upon that, they will be giving us some conclusion, right? We have some definite indication in the disease, and that the doctor will be able to tell us that what are we suffering from. So over here, the temperature, heart rate, blood pressure, redness and rashes, all of these are the signs that are present, right? So over here we have nausea. So of course, it's a feeling of kind of vomiting. You're not feeling comfortable. You have that, you can, a little bit of, a feeling of vomiting here. Yes. It's not exactly the vomiting, but a feeling of vomiting. You just feel that, okay, something is not good with your stomach, or you want to just throw up. Yes. Very good. So we are clear with signs and symptoms. Again, it's a very important question. Can be easily asked in the examination to differentiate between these two. So keep a note of it and a smile from my side. Everyone, are we clear with the disease and this, right? The symptoms, disease and the signs. Now we'll be moving ahead. Further, now chills are something that a person will be experiencing during if you talk specifically about the malaria fever, you will feel chill, right? You will feel that it's cold. That's chill and you will be shaking. Yes, very good. Moving ahead to the classification of disease, and from here, the main topic starts, right? We have the classification of disease. We can easily classify disease on two, based upon the duration and based upon the causes. When we talk about the based on the duration, one of you, like I think one or two of you have asked about that, ma'am, tell us about the two types, right, over here. So based upon the duration, we can easily categorize or classify the disease in two types. We have the acute disease and the chronic disease. Now, acute disease are those diseases which will be there in the body for very short time, maybe for 5 or 6 days or less than that, cold, right? It is a acute disease. Whereas in the chronic disease will last for months or maybe for years also. So over here, that's a major difference between the acute disease and the chronic disease. Over here, of course, we know that it will be there for a very short time, and chronic disease will be there in the body for a very long time. Now, can you write some examples of the acute and the chronic disease? Yes, come on everyone. Very quickly, write the examples of the COVID-19. So it definitely the first wave and the second wave, the variant that we have was for the, we can say for the chronic disease, because it lasted for more than 2 weeks, right? But now I think the third wave in which we have the different variant, which some, like in various people, is just there for 7 days. So yeah, based upon that, acute, common cold, and chronic, you're saying cancer. Yes, TB, right? All of these, AIDS, again, it's a chronic disease. Yes, very good. Blood pressure, yeah. Diabetes, again, it's a chronic disease. Very good. So over here, let's quickly sum it up. We have the common cold, malaria and diarrhea, the common examples of the acute disease. And over here we have HIV, diabetes and cancer. These are a few examples of the chronic disease. So we have based upon the duration, we have two categories. We have acute disease and the chronic disease. Yes, I can see the long list of the disease. Very good. Yes. Moving ahead, let's talk about the causes. Now we have the classification of disease based upon the cause, how they are being caused. Now over here, I think one of you asked about the contributory cause, so please focus over here. So when we're talking about the cause, in that it's a long, deep dive that we'll be taking. And over here we have the various different causes that will be causing the disease. Over here we have the list, right? Everyone focus over here. Yes. So seizures, what happens when the body suddenly starts shaking? There are seizures, you don't know what is happening in your body, right? And yes, I think that answered your question. Very good. Yeah, so over here we are discussing about the causes of the disease, and over here we have few. The disease can be there in our body and can come to our body by various different these causes. So we have pathogens, lack of nutrition or nourishment, genetics, right? Poverty or the lack of the public services, and of the pollution. Now out of these 5, pathogen is usually the immediate cause, right? When we talk about the immediate cause, if a person has to suffer from a disease, the pathogens can go directly into the body and can cause a disease, right? When we talk about the contributory causes, that means that these will be helping, or we cannot use the word helping, but will be contributing in causing a disease. So it's not that if you're eating on one day, if you're not eating the nourished food, you'll be getting a disease. No. If you're not eating for a very long time or for a very long period, then of course your body will be having a deficiency of certain kind of minerals or vitamins. Then we have genetics, of course. Now if the genes are right, if there's a mixing up of the genes, or if there's some addition or the deletion of something in the DNA, if there's some damage to the DNA, then of course the genetic diseases will be caused. That's a basic thing that we can understand. Poverty and the lack of the public services, if an individual have, if an individual is below the poverty line, and of course have the lack of the public services, right, then of course it can lead to a disease, right? So it can be a contributory cause. Then of course pollution, we have allergies, asthma, right? So pollution can be a big reason behind it. Yes? Everyone, are we clear? Does typhoid spread? Typhoid, okay. What do you think typhoid is caused from? It's caused from the bacteria. We'll discuss about it. You find it out. It's really, the way you have studied it, the answer is there. Yes. Nibha, I've answered your question. We will be discussing about the vaccination and immunization. We will be doing it. Right? So just wait for a while and then we'll be coming back. So, Game Tan, HIV is a virus, right? And AIDS is a disease which is caused, right? Over here, so that's one thing that you should remember about it. Very good. Niva will be discussing about it. It's a disease caused by the worm. Yes? Okay. Allergy is not a cause, right? We can count it as like if there's a person who is allergic to smoke or to dust, that might lead to some reactions in the body. Very good. Okay. Now that we are clear with what are the immediate cause and what are the contributory cause, we'll be discussing about further that how we can move ahead, and we have the various classification. So based upon the causes, again we have the infectious disease and the non-infectious disease. Of course, infectious disease are caused by the pathogens, right? Be it the different pathogens we have, and non-infectious disease will be caused due to some internal reason. If this internally the body is not functioning properly, then the individual will be suffering from this particular disease. Over here we have the few examples. Of course, tuberculosis, TB, malaria, pneumonia, right? All of these are the diseases that are caused by the infectious agent, pathogens. Whereas non-infectious disease are like goiter, which of course occurs in the thyroid gland, right over here. And thyroid gland, we know it's really very important for the metabolism. Then we have the diabetes and cancer. These are the non-infectious diseases. These will not be moving from one individual to the next, right? It will not be going. Yes? So that's all about the infectious and the non-infectious diseases. Under infectious diseases also, yes, under the infectious diseases also we have two types. We have communicable diseases and non-communicable diseases. In communicable disease, of course, a disease can be easily spread from one person or an animal to another. Whereas a non-communicable disease is something which will not be easily spread from one individual to the next. Yes? So that's very easy. Over here we have the example that will help you to remember about this. So food poisoning, if an individual is suffering from the food poisoning, we will not be able to give the food poisoning to our neighbors. But if a person is suffering from the tuberculosis or malaria, right, it is a communicable disease. Yes, everyone, are we clear? Yes. Harmeet, COVID-19 is communicable. Yes. Anthrax, yes, it's a disease, right? We see it in the animals and of course in the humans also. It is caused by, we have to find out. I'm not giving you the answer. It's really very easy, but it's really very dangerous disease. Yes. What is the one level? What is level 1 immediate cause? Pathogens. Neo, it's pathogens. Tetanus is non-communicable. Yes. Diabetes is a disease. Yes, we have just discussed, right? Very good, Manimala. Yes, diabetes is a disease, but it's non-communicable, right? And of course, it's the non-infectious also. Very good. So we have it. Nibha, the difference between the infectious and non-infectious is that infectious disease can easily spread and the main causing agent will be something that easily will be going from one individual to the next individual. Non-infectious disease, when we talk about, they're the one that will not be getting affected, right? It will not be moving to other individuals. Very good. Clear. So I can see Manoj will be discussing about it. We'll be discussing about that in a while. Yes. Okay. Clear all your doubts? Very good. Yes, Jayantika. Okay, very good. Moving ahead, let's quickly talk about the different types of infectious agent and the diseases that are caused by them. You can take a screenshot of this, everyone. This is really important. Yes, we have this. We have virus, bacteria, protozoa, fungi and worm. These are the few disease-causing agent or the infectious agent and the disease that are caused by them. Right, so we have common cold and dengue, which is caused by the virus, typhoid and food poisoning by bacteria, malaria and amoebiasis by the protozoa, ringworm and athlete's foot by the fungi, and elephantiasis and ascaris by the worm. So here we have, and if we have to segregate these into the communicable and non-communicable, we have this. Yes, over here we have. Right, everyone? Great. So we have the differentiation over here about the about the communicable and the non-communicable diseases. Sanskriti, I'm sure you will be able to differentiate between the infection and disease, right? A disease is a disturbed disease. We're talking about the infection that will be caused by some of the pathogens, right? Kala Azar, it's caused by a protozoa. That's a hint I can give you. You can find the answer. Yes. Okay, now I can see something is happening. Very good. Thank you for supporting your teacher. Yes. Very good. So are we clear with this, everyone? Are we clear with this? Very good, very good. Oh, yes, we'll be discussing about it. So athlete's foot is a disease caused by the fungus, right? Between the feet. You might have rashes, there will be itching. Yes. Okay. I think we have this. We are sorted with this, right? So let's move ahead very quickly to that how you can prevent the infectious disease spread. So how we can prevent, right? Or how do the infectious diseases spread? And we'll be coming to the preventive measure. Oh, you guys are asking about the preventive measure. Yes? So of course, how these diseases are spreading? Of course, these diseases spread from the infected individual to the healthy individual. Let's talk about the modes or the means of spreading, right? Yes, over here. Yes, Ritushri, I'll be doing that. Give me a minute. I'll be doing that. MK, you can write your doubt. Okay. So we have various different agents, right, or various different modes of transmission, we can say. We have air, food and water, direct contact, indirect contact, and of course the vector. And over here we have the name of the disease. I'll not be going into this much detail because it's really very easy. If, of course, in the air, if we have the pathogens, and of course, if we are in a room with the infected individual, we can easily get the disease. If we consume a food or a water which is contaminated by the various agents, we can get the disease. Talking about the indirect contact, of course, the conjunctivitis, right? If you touch a handle or if you are on a desk which was used by the person who has this particular infection, we will definitely get it. Then direct contact, right? Direct contact includes the handshake. In a case of ringworm, using a towel, right? Then we have the sexual contact that can easily lead to a disease like AIDS and syphilis. Okay? Then of course we have the vector. In that we have the vectors that will be carrying the pathogens, right? That will be carrying the pathogens and that will be causing the disease. We have malaria and dengue. Yes, everyone, are we clear? Very good, Anshita. Someone is asking for the definition of AIDS. Suhani, anyone, can you help her? It's really very easy. Right? Okay. Yes, SARS is a disease causing AIDS and is virus, right? Very good. Very good. Yes, Varshini will be discussing about it. The difference between the non-infectious and non-communicable. Non-infectious, just think now, they are not causing by any infection. It is there. If there's a body not working properly, all of those disease. We'll go back. Just give me a while. We'll be discussing in the summary slide. Yes. Okay. Moving ahead. Very good. I can see you guys are helping Suhani mentioning about the full form of AIDS. I think MK has the same doubt. Very good. Acquired immunodeficiency syndrome. And I think many of you are asking what is the difference between a syndrome and a disease. Again, in a syndrome, a person will be experiencing different types of symptoms altogether. And basically, they'll have different diseases altogether, right? Immune system is not working. They can get cold easily. So there'll be not one specific disease. Okay, moving ahead, let's quickly talk about this case, right? And this is important. We have this very interesting disease, right? I'm sure you remember about this. Yes. Now, what is happening over here? We have a mosquito, right, which is definitely will be biting the individual. And of course, slowly what will be happening as the pathogen will be moving into the body, you know what will happen? It will be going to the brain. And then only the symptoms will be showing. So such types of manifestation, we call it as the organ specific. So the pathogens are really very organ specific. They will be targeting the organ, and once they'll be reaching there in the organ, and then only the symptoms will appear. So this is one. Remember this. In the examination, if they ask you for the difference, you know what you can write in the examination. Then of course we have the AIDS, right? Now over here, someone was asking me about the AIDS over here. See? Now in AIDS, when the virus enters into the body, right, slowly the symptoms will appear. It will take years to come, and it will be targeting the tissue, right? It will be targeting the lymphatic tissue. So such type is called as a tissue specific manifestation. Yes, everyone? Are we clear? Yes? Yes, Nibha, you are right. Kala Azar is caused by the leishmania. Yes, protozoan. Yes, are we clear with this? Very good. Okay, so just remember about this, the tissue specific manifestation and the organ specific. This is important. Okay, lymphatic system or the lymphatic vessels we have in our body, right, where the lymph flows. Now we usually talk about the lymph, right, which is an extra fluid which does not have the red blood cells, right, and of course it has various fluids basically just there in the body, and it actually helps in carrying out the, provides immunity. It's there in the body, it flows through into different parts of the body. Yes. Everyone, are we clear up to now? Very quickly, we don't have much time, right? Yes, we are clear with this? Very good. Awesome. Okay, moving ahead, let's discuss about the principle of the treatment, how we can treat it, right? So over here we have two, targeting the symptoms, and of course on the other side we will be targeting the pathogens. So of course when we talk about the targeting the symptoms, right, for example, if you have a fever, what will happen? What will happen if you have a fever? How you'll be targeting that? Of course, if you are If you had a fever, first thing you'll be trying to bring down the fever. We will be getting rid of the headache, right, which we usually have the headache. Of course, we will get the lot of amount of rest to get the energy, right, to kill the fatigue. Now, we will be taking some medicines, right? We will be taking some medicines for that. So, we will be taking the medicines to reduce the symptoms of the disease. To reduce the symptoms, right? We'll take a medicine and of course, what will happen to us? Our body temperature will come down. This is important. Right? MK, for that you have to come to the next session if you want to learn about the independent assortment. Yes, menstruation is not either the acute or the chronic disease. It's not a disease. First of all, let's address that. It's not a disease. Very good. Okay, right? So, when we target a symptom, right, it focuses more upon the healing. Now, if we have to think about in a broader way, if we have to get a relief, right? Now, think about it, what will be the cause of it? Now, we'll be focusing on the other part, which is targeting the pathogens. We'll be targeting the pathogens. And how we can target the pathogens? By simply, for example, if an individual is suffering from the typhoid disease, right? And of course, when we look it over here, we have the causing agent. And of course, if we want to target this, can you tell me what an individual will be doing? Yes, if we have to specifically target a pathogen, we have studied this, right? Satyajit, can you write what is not clear to you? It will be easy for me to identify it. Yes. Right, everyone, please write. Very good. Abhiyaditya, yes. Antibiotics, right, very good. Ravinder. Yes, Ravindra. Suman. Antibiotics is the answer and I can see a lot of you are answering. Very good. If a person is suffering from a bacterial disease, he or she will be taking up the antibiotics, right? We have different symptoms altogether. We might take the, fever. We might take medicines to reduce the fever. We might take medicines to reduce the body pain, right? But eventually we'll be taking the antibiotics to actually fight the pathogens, right? And of course, in this case, we have the bacteria. So the antibiotics will be working on the bacteria only and will not be working on the others, right? And they will be killing the bacteria by actually hampering or blocking their biochemical pathway. So this is how they'll be working against the bacteria. Yes, and when we discuss about the different types of pathogens and their medicines, over here we have, so you can take a very quick note of all of this. Antibiotics, antiviral, antiprotozoan and so on. Yes, okay. Shivya, you're spamming, so please don't. If you have to if you want to ask a question, please write it over here. Very good. Yes, Suman, you can write your question. Very good, everyone. Okay, so we have this, right? So we know what are the types of pathogens and what are the medicines a person will be taking against that. Again, you can take a screenshot for your better understanding. Yes, Nibha, worm pathogens. So we have different types of worms that can cause various diseases. Ringworm, the ringworm is the fungi. So we have this, right? We have Ascaris, which will be causing the ascariasis. So over here, a worm that will be causing a disease. Right? Very good. Now, let's move ahead and talk about the viral, right? The virus. We know that the antibiotics will not be working on the virus. Can anyone tell me why? And of course, making of the antiviral drugs is really very difficult. Please tell me why. Why you think that antibiotics will not be working on the viruses? So, antibiotics are the drugs that will be working on the bacteria only. Meenakshi, to answer your question. MK, again, antibody and antigens we'll be discussing in a while. Just give me a minute. Yes? Very good, because antibiotics are only for the bacteria. Because viruses are both living and non-living, virus are cellular. They have less, okay. Very good. Aditi, very good. Interesting. Very good, Neo, talking about the protein code. That's how the antibiotics will not work. Very good, you're answering absolutely correct. So let's quickly recall the things that you've already said. We know that viruses are living inside the host body because they'll be moving inside the host body, and then of course using the host body cell machinery to make multiple copies of them. They're dead outside the body, right? So even if there are viruses outside me, they are dead, right? When we talk about the antiviral drug, it's really very difficult for us to make the antiviral drugs for the viruses because one thing very special, they will be using our cells to make the multiple copies. They'll be using our cell machinery. And apart from that, we just cannot work on the viruses, and the making of the drugs, especially for the viruses, is really very difficult. Yes, so we have this. Now, of course, we cannot target a specific area where virus will be working over here. Let's see. Right? Okay. Now, along with that, we have some limitation of the treatment. Now, over here, we'll be moving towards the important part, right? When we talk about the medicines, what will happen? If you're getting a treatment, what will happen? Your body functions may not recover properly. There is the cases in the COVID, right? Of course, the person have recovered, they're negative, but still, they are still taking some time for their body to function properly. That the person is likely to be bedridden for a very long time, and of course, we can easily spread, even if the person is cured, right? The person can spread the infection. So here we have few of the limitation of the treatment. Now, we'll be discussing about how we can counter that with the help of the prevention. And in the principle of prevention, we have two things. We have general methods and specific methods. When we talk about the general method, right? When we talk about the general method, let's quickly discuss ways that you and I can say do it at home, right? So over here are avoiding the crowded places, safe drinking water, should not be drinking the contaminated water, clean environment and good immune system. Now these are some general method. Yes, these are some really very general method. Okay, are you there with me, everyone? MK, again I said that antibodies will be discussing now, so I request you don't spam over here. We don't have Menti today. Yes. So after the puberty that will be hitting, after the puberty in the adults, the height will be increasing for a while, but it will not be moving. It will not be increasing much though. Very good. Are we clear, everyone, on this? Up to here, are we clear? Very good. So we are discussing about some of the general methods, and moving ahead, let's quickly talk about the specific methods, right? Now, specific methods are the vaccine. Those of you who are talking about the vaccine and the immunization, here we have. So immunization through the vaccine, we are making our body immune by using the vaccine. So a vaccine is nothing but the preparation that it will be stimulating the body immune system to fight a disease, even if it's not has come in contact before. So for that, of course, we have the vaccines, right? We know that Edward Jenner was the first one to make a first vaccine, right? And of course, that was a breakthrough. Now, vaccines will be mimicking the microbes and will be trying, to help to fool our immune system, and they're really very good. When we talk about the vaccine, we are not injecting the living organism, right? I'm sure all of us have taken vaccines. Please raise your hands if you have taken vaccines. Come on. I know that many of us have. Right? When we go out, right, when we take the vaccines, what happens? Of course, in that particular bottle of liquid, right, we have either the very dead organism or inactive organism, right? Or the microbes, right? Once we will be taking that inside our body, what will happen? Now, MK, your question comes over here. So, all these cells, right, of course, these are the antigens. Now, in our body, we have antibodies. They are a part of the WBC cells, right? They are the ones that actually help us actually fighting the diseases. It's really very important. So when we talk in the terms of antigen and antibody, there are two important things we should remember. So these are present in all the pathogens, right? The antigens are present, right? And once these will be entering into our body, when we take this particular vaccine, what will happen? We will have an amazing army, right? So this particular white blood cells will be actually going out and will be eating up the organism or the virus, right? Or the pathogen which just came from the vaccine. Once that is done, of course, this particular pathogen attack will be making sure that the cells are getting activated, they have the information with them, and they will remember it. So in the future, when there's a real pathogen entering, right? If the real pathogen is entering, what will happen? Ha ha ha. The WBCs or our immunity, right, in the body will be easily killing them, right? That's how the vaccination works. And this whole process is called as the immunization. Yes, I can answer a few questions. What is the difference between RNA and DNA? DNA is deoxyribonucleic acid. RNA is the ribonucleic acid. RNA is single stranded. DNA is double stranded. In humans, we have genetic material, which is the DNA. Okay? Yes. Are we clear with this? Yes, are we clear with this? So, two things, everyone, when we talk about the vaccines, right? Just remember the examples and the difference between, many of you were asking about this. So, here we have, right? What is the difference between the vaccination and the immunization? Over here we have. Yes? So, vaccination is the administration of a vaccine that to stimulate the immune that will be coming into our immune system to develop the protection from a specific disease, and the process of becoming immune to a particular disease is called as the immunization. Yes, if I am taking a vaccination, I am protecting my body, and of course what is happening, this process name is the immunization. It's a very interesting question that why do we get fever after a pathogen attacks our body? So basically, initially, on the very initial days, our body is trying to fight, so it just increases its temperature. That's a one way of fighting that, okay, if you increase the temperature, might be the microbe or the pathogen will get killed, right? Of course, it will not be, it will become inactive in that way. Yes? So with this, everyone, we are done. I think I'll just quickly address few questions that you had, right? Over here, so you know definitely what is health, different types of health. Then, of course, we have disease, right? Of course, caused by the pathogens. There are various causes. We have immediate cause and the contributory cause. Then, of course, I think few of you have a doubt in the infectious disease and non-infectious disease, right? And of course, we have this communicable disease and the non-communicable disease also. And of course, we have the tissue and the organ manifestation, right? And over here, we have discussed about the how we can actually fight a disease, prevention by medicines, right? And of course, by the vaccination. And here we have the principle of prevention, which is really very easy. We have just done it, so I'll not be going into the details of it. Yes. Are we clear with this, everyone? Yes, are we clear with this? I hope that you've enjoyed. See, it's a very quick revision. If you had any doubts, right? If you had any doubts, what I would suggest that you can go back to the previous classes we have, right? The concept capsule classes we have, right? And you do give it a watch again. We have covered all the important topics, right? Over there. And yes, so you will be able to learn. Right, everyone? And on that note, over here, I was looking over here, ma'am, 1 hour of quiz, 1 hour of quiz. So here we something have. So we have final question, right? And of course, on 17th of Feb, we'll be discussing about most important questions and we'll be having a lot of fun. Yes, Ravinder, we can say that vaccination is a kind of immunization. Yes, absolutely correct. Thank you, Ashish. I think I've missed that question. Antigen, yes. And foreign particle that can initiate an immune response. So, yes. So, antigen is usually the foreign particle that will be entering in our body, and we have antibodies in our body, right, that will be working against it. Yes. Contributory causes are those causes that will be causing, right? They're not the immediate cause. In that, for example, if I'm not eating nutritious food, I might get disease after a prolonged time, right? So those are the contributory causes. Disease caused by fungi, we have ringworm, right? That's we have athlete's foot. We have a lot of fungal infection. We have dandruff, like severe dandruff that is caused again by the fungi. Cholera, caused by the bacteria, right? Amoeba, the other one. Yes? Very good. So B cells and the T cells are there in our immune system, right? And they are a type of WBCs that actually help in providing the immunity. Yes. So everyone, I think with this we are done with today's session. We have got you covered. And after this session, I would request all of you to hit the like button, share the video with your friends, right? Yes. And don't forget to subscribe to the channel. We have amazing sessions coming up for you. And definitely after this class, you can try the free class. There's a link down below. You can click on the link and that will be taking you towards the class. So do it. I'm sure you will enjoy that thing. Very good, I think. Thank you so much. Ravindra, athlete's foot is a disease caused by the fungus, right? And it will be having in the foot. Yes. Thank you so much, Nibha. Already subscribed? Yes. Neo. It's a very easy one. It is a bacteria. Or no, it's a protozoa. Find it out. Okay, everyone, on that note, I'll say bye-bye to you. Take care, everyone. We'll be meeting next week, right, for the 9th class. And enjoy. Keep on learning. I would suggest that this chapter is interesting. And I would request all of you to read your NCERT. Right? Read your NCERT because it's kind of a hidden treasure we have there. So each and every time when you're learning, right, when you're reading the book, you will be learning something new. So read the textbook. Bye-bye, everyone. Thank you so much. Lots of love. We'll be meeting again. Bye-bye.